Our next generation digital exchange webinar. Today, we're grateful for you all joining us to talk about integrating community health, arts, and culture. My name is Matthew Fluharty. I'm the Executive Director of Art of the Rural, and I'm really honored to have you all with us today for the conversation we're about to have in the next 60 minutes. So a little bit of information about this series. In 2016, with the support of the National Endowment for the Arts, Art of the Rural and the Rural Policy Research Institute launched Next Generation, which was an initiative that was focused on bridging conversation, collaborations, and network building within the really broad rural creative placemaking field. As an initiative, NextGen operates through 3 interlinked activities: cross-sector regional networks that at this point are state-based, a digital learning commons that folks can find at ruralgeneration.org, and a national rural creative placemaking summit. Our inaugural convening was last fall in Iowa City, which brought together 300 people from 38 states to talk, to build trust, to build connections, and to think about what the future of our field looks like. After that summit, to build upon the collective energy of that group of folks being together and to help spark further connections across the nation, this digital exchange series began. And our hope with this is to continue building on the power of connection and to bridge further conversation across different regions, sectors, and place-based philosophies. So roughly every 3 weeks or so, these digital exchanges occur, and folks come together, they engage with leaders across the country, and then they have a chance to continue that conversation in various ways with those leaders, and then in ways beyond just this digital space. So each of our 1-hour digital exchanges feature 2 to 4 voices from across the country, talking about specific themes, challenges, or opportunities that we all face in this work. And I think it's important to say, while some of the elements of the series do resemble a familiar webinar format, our hope is that this is the most unwebinary webinar possible. It's a social space where we can gather, share ideas, and improvise, and just think about new ideas that can emerge and new connections that can be made in our space. So for folks who are joining us, we're really great to have you all. And if you have not used Zoom before, if you see the bar in front of you here, you'll see a little box kind of in the center of the screen that says Q&A. That's a space for folks who are joining us to ask questions of the panelists and our moderator. And we'll talk a little bit more about opportunities for that towards the close of the conversation. But if questions or ideas or connections emerge, please feel free to add those there. You also see a chat bar a couple steps to the left of that. It has the little comic book icon there. Feel free to add links to your own work or just responses to what you're hearing there as well. Our hope is that this is as conversational and connected as possible. The basic outline for today's conversation will be, I'm going to get out of the way here in just a moment, and we will have about 10 minutes for Mario to help to introduce himself and to share the context for a lot of this rural health work nationally out of his own research and what he's learned from his colleagues across the country. Then we'll have a great opportunity to hear both from Jen and then Anne, and then Mario will help in facilitating some conversation between our guests. And that'll take us to about 20 to 15 before the hour. And then that's a moment where we can hear from all the folks across the country who have questions for our moderator and our panelists, and we can open up that conversation more broadly. So again, for folks who are joining us, please do feel free to add questions into that Q&A box. So really, without further ado here, we are so grateful to have these folks with us today. And I'll just say a brief word quickly, and then we'll be able to hear so much more about their work. We're really honored to have Anne Basting with us, who's a professor at the University of Wisconsin in Milwaukee. Hi, Anne. Thank you so much for being with us. She is also the founder and president of Timeslips Creative Storytelling. And joining Anne is Dr. Jen Connor, Regional Program Associate at the University of Arkansas Cooperative Extension Service. And we're also really excited to have Mario Gutierrez with us, helping to moderate and add to this conversation. He is the Executive Director at the Center for Connected Health Policy. So really, without further ado, what I would like to do right now is just get out of the way and pass the mic to Mario. Thank you all so much for being with us around the country, and take care.
Thank you, Matt. It's a real pleasure to be here with you today. This is really for me, very personal, because my undergraduate training was actually in art, and I was a frustrated artist for a long time until I got caught into the social movements of the 60s and somehow fell into healthcare. I currently chair the RUPRI panel on rural human services. It's an advisory panel that I think is extremely important in all of our work in health, because so much of what we hear in the context of healthcare is really leaves out the whole question of health. And so what we bring within our panel is a perspective of evidence-based research as to how the social determinants are such critical factors in shaping the health of individuals, families, and communities. My own work goes back to times when I was working with the American Indians here in California. That's really where it came home to me as to how culture and family and the spiritual nature of what creates a healthy community was so evident. The song, the dance, the gatherings for food, the sweats that were held, all of that was part of the overall health. As a health planner for several tribal governments here in California, it really woke me up to the fact that I was so focused on the clinic and not on the fact that there's many other factors that contribute to the sense of culture, and certainly with American Indians, culture is dominant. The other aspect of my work that I'd like to highlight is I was part of the start of a new foundation here in California, the National Endowment, which was endowed with $3 billion to improve the health of the people of California. And being part of a new organization without any prior history and with a mandate to spend money almost immediately, we had the opportunity to think very differently about what are the contributors to good health of families and communities. And so in addition to health care, we set aside 50% of the money for improvements in health, and with an emphasis on what we call multicultural health, knowing that California was a very diverse area, and I was director of all the rural health programs related to that. So it really gave me an opportunity to go up and down the state and to see how the interplay of community organizations, of religious organizations, of family efforts in the volunteer sector, all contribute to how we make a healthy community. This whole notion of the culture of health really came clear, and you really see it in a state that's predominantly rural. And when we go from one end of the state, from the far north to the south, we find multiple cultures. And I'll just end with a couple of things. One is really a story that really struck me in terms of health was when we were working with the farm workers in rural Salinas Valley, one of the highest concentration of farm workers in the country. And we now see a large influx of the Oaxacan and Guatemalan Mayan workers who have moved in thousands of workers now in California really come from those communities. They don't speak Spanish, they don't speak English, they have their own indigenous culture. And we were opening up a new community clinic in the south end of the valley and invited members of the community to be there. So there must have been a couple of hundred people from the community. And we talked about the services being provided. And at the end, we asked for questions. And one of the mothers raised her hand and said, "This is all good," in her own language that was being translated. But what we really need is yarn. We need yarn to do our weavings. We need yarn to make our clothing and our huipiles. And so that to me struck me as they understand it. They got it very clearly what health is all about in their community from our perspective. And then finally, my work now with the Center for Connected Health Policy, which is really about technology and advancing access to care using virtual means through broadband and telehealth. You wouldn't think has much of a culture component to it, but I think of it about how we use these technologies to build community. And just the notion of being able to use remote monitoring to connect our older populations in rural communities to stay healthy at home, be able to be connected, to not have the sense of social isolation that we find in so many areas, and bringing that communication virtually where before they couldn't do it and would be institutionalized. To me, that's really important and really humanizes the whole notion of technology and health in a way that really brings it home. So that's who I am, and I'll be moderating this session. I'm really excited to hear from our panelists here, from Jennifer and Anne. And at this point, I'll turn it over to Ashley.
So are we going to me or are we going to Jen?
I'll jump in, Anne, and then I'll turn it over to you.
Okay.
So hello, it's a delight to be with you guys today. My name is Dr. Jennifer Connor. As Matt said, I'm with the University of Arkansas Cooperative Extension Service. Much like Mario, I spend a lot of my time looking at the social determinants of health. I've kind of weaved my way to where I am today through a lot of different things where I worked at the individual level doing health promotion and health education, and then kind of moved up the sociological ecological model and really worked with systems, looking at how our faith-based community or our peer networks really influenced our health behavior. And then kind of took a shift and said, well, while individual and clinical behavior is important, moving into the larger context of our neighborhoods, our organizational systems, is really where I've spent the majority of my career. Come from a built environment background. So it's the old age saying that if your doctor says go exercise, but you have nowhere to go, whether it's sidewalks or facilities or things like that, that's really where we focus, and that lends itself to a lot of art and culture. We like to go out and exercise and be healthy or eat things that are important to us. So that's, again, where that cultural piece comes in. My formal training is a doctorate of public health. And so, again, looking at community engagement and how are we building coalitions that include a lot of sectors and a lot of partners, like I said, from our healthcare providers and our hospital administrator to our, our artists and everybody in between, our school teachers, our mayors. And so really the last 5 years of my work has been building those coalitions and really having candid conversations about what community priorities are, what our health indicators are, but not just how many strokes and what's our obesity rate, but then how does that connect to our economic development? So what is our workforce indicators? What metrics are we using, in terms of lost days work and diabetes management? So really just pulling that information together to guide communities through community development, healthcare initiatives, and community wellness. So that's kind of my space. I'm in the Mississippi-Arkansas Delta, so I'm 11 miles from Mississippi and 11 miles from Louisiana. We have lots of rich culture and history here, so really trying to tie that in. And then in my role at Extension is really pulling in our agriculture base, not only from the food production and food consumption side, but also how can we integrate agritourism and ag-based art adventures. So it's been a fun ride, and we have evaluation techniques where we're really trying to show our impact, again, all the way from the individual and the system level to our community and policy levels. So that's a little bit about me, and with that, I'll pass it over to Anne.
Hey, everybody. So I do the same thing, except I come from, I do it as an ensemble theater artist. So I began my work primarily through the lens of being an artist and working in theater, doing devised, community engaged practice where we you make art out of collaboration. And so it's this marriage of collaborative devised art and community identity and expression and health and multiple systems and partners. It's almost as though, to me, it's concentric circles of starting with the arts group, and then just building more and more partnerships all the way out. So it's just from a different perspective. I have a PhD in theater. I'm at the University of Wisconsin in Milwaukee, where I teach community engaged practice, arts and social entrepreneurship, storytelling, fun things like that. I came to the work early on in my doctorate about looking at the social performance of aging and what social roles we older people can play and what they can't play, and where the taboos are, and what how we might expand those. A lot about social connectivity. I wrote my dissertation about senior theater groups all across the country, and particularly one story that I think illustrates the power of being involved in a strong network and ensemble, creating something new together, is an interview I did up in Brainerd, Minnesota, with an older woman, and I said, "What did you do before you were part of the Geritol Frolics?" And she said, "I was a widow." I said, "What do widows do?" And she said, "We watch TV, and our children call us on Sundays, and we go to church." And I said, "What are you now?" And she said, "I'm a comedian." I said, what do comedians do? Well, then she told me the long story of going to rehearsals and being enveloped in this community and having a really difficult time going down to the diner because people recognized her and wanted to talk to her. And it had completely transformed how she understood her own value in the community, her connectedness. What happened out of that work, though, was that I realized that most of the people I'd been writing about were healthy, relatively healthy. And that what happened at the edges of those performances when real significant disability came in, and how could those strengths of performance do they translate? And particularly, that's where I started working in dementia specifically. And I really see the core of this work as meaningfulness. I think so much of the healthcare system, Jen, like you said, is about preserving health and these core issues that we look at, reducing diabetes and obesity. And when the place I think the arts really come in my perspective, is bringing meaning into people's lives through social connection and expression. And that's the work I've been doing with dementia for probably 20 years now, with Time Slips, which is a nonprofit that I work with. And we have come to see it as bringing kind of a hub for creative engagement for people wherever they are. Just finishing a 50 nursing home training across the state of Wisconsin, where rural nursing homes and urban alike, so that people feel connected and we're able to bring creative expression resources to people wherever they are. So that's a little bit in a nutshell what I do, and I think I can get to turn it back over to Mario.
Wow, that's pretty exciting. Two very diverse perspectives here, coming from more of an academic sense of what contributes to health and understanding it from the behavioral context, and then just the pure storytelling, being able to use theater and dance and such to get at the issue of health. And I was struck by the fact that Savannah, the way you presented this, you hardly used the word health in your description of what you do. And I'm wondering, to what extent in your work with dementia and with the communities that you work with, do you come at the question of improving health from the context of social well-being, physical well-being? How do you bring that about in your context of your work, so that the participants really understand what's really happening?
For me,
Mm-hmm.
It depends on the project. What we do, I find that overall in the work that I've been doing, sort of making creative engagement accessible to people with memory loss and dementia, that it really is about well-being for me. There is such a cascading effect of, well, I should say there's such pressure in the field to try to improve cognition. And to me, it's not what is important. What's important is feeling connected and having meaning in your life, which is really well-being. So what I look at is, I also, as a core theory, see identity as relational. So when you have a person with dementia, we look 360 around the person to the well-being and the relationships fostered with all care partners. So whether they're professional or family, informal, neighbors, what kind of social connectivity are we able to bring to it, and what kind of, we also look at the art making, and we look and see the themes of the stories in the expressions. We look at the attitudes of staff and family to see if this changes their perspective on the strengths and what's possible as a way to connect. We've had that kind of a change, as you might imagine, particularly with students that we bring in with service learning, that they begin with all kinds of negative assumptions about what's possible and not wanting to work in the field of aging, and attitudes about their own aging, that change dramatically when you create a space in which people can co-create in meaningful relationship. It's pretty transformative.
That's amazing. Jennifer, you talked about an area of the country that you're currently working in and where you are now, which is in some ways considered one of the poorest areas in the country for African American, at least from the perspective of monetary income, but I think rich in culture. And so can you talk a little bit, give us a sense more from a personal story of how you use your work to improve the sense of self-esteem from knowing that there's such a rich culture there despite their poverty?
Absolutely. And yes, if you look at the Arkansas, Mississippi, Louisiana Delta, which I am right in the corner of, we have the highest rates of poverty and low education. So really some of the techniques that we use is, again, working through our faith-based communities, working at the library, which we know in our region is a hub of the community. I don't even want to say city, but of the town or the community, meaning it may be the place where the only computer or internet access is for someone. And so we use a lot of techniques like photo voice, and so we photo journal people along their health journey. So for instance, if we have a factory that I work in, where we do a lot of worksite wellness, and so we have a Know Your Numbers campaign. So if we identify someone who is perhaps undiagnosed or with hypertension, or perhaps not being controlled in their hypertension, then we kind of journal it with them and make sure that they're triaged to the services that they need, but also the health coaching, the peer health coaching, looking at the environment itself. So do the vending machines have the opportunity for that person in the factory to have a healthy snack when the whistle blows at 3 o'clock? Can we put a walking trail or a walking path or designate a walking path around that factory? So we really looked at place-based solutions, and then also again using photography and the arts, as well as, like I said, just peer coaching seems to work well. I'm known a lot around town as the cheerleader. So if I walk into a restaurant, they'll say to me, look, I didn't get fries today, or I got the junior burger, or whatever it is. And so we know that we're making a difference in terms of connecting. I think that goes to Anne's point, is we're connecting them to community champions that are like them. And so having those community champions, those workplace champions that someone can relate to, I think has been part of our success with our programs. And so, you know, we like our soul food, our fried chicken down here. And so we're, you know, working with faith-based organizations to say, how can we have a healthier potluck? You know, how can we sweeten our greens perhaps with applesauce instead? So definitely taking in our food and our culture around our eating habits, and then making that a best new norm, if you will, but not losing the heritage that we have. I'm in a large Italian settlement, so we love the pasta around here. But again, thinking through how to make that the healthiest pasta available. And so a lot of the times I say, I'm not here to take away something. I'm here to just figure out a way to fit it in your lifestyle. And I think that's important as you're working and doing community engagement, because you know, I'm not the obese police, as they often say, because this is not about that. It's about changing, you know, what has become the norm after, you know, restaurants increased our portion sizes, and you know, we got away from gardening and we're bringing that back. We got away from homesteading and canning and we're bringing that back. And so, you know, how do we bring our heritage to make a healthier lifestyle?
Yeah, that's interesting. I had a similar experience when I was working with the native tribes in the Eastern Sierras, and we were trying to address the issue of diabetes, which is, you know, type 2 diabetes is endemic in this community, and moving to medicinal interventions, you know, and moving away from insulin and addressing it from diet and lifestyle. And it wasn't until we understood it from the perspective of culture that we really had an impact. It wasn't getting them away from the fried breads and the fried, as you described, the fried chicken and all that, but learning how to do it in different ways that was more healthy. And then thinking about physical activity, not just from doing exercises, but what do they naturally do in terms of their traditional cultures and dance and things of that nature. And that really struck home. You also, you know, I think touched on something that's so important in the work of that Matt is putting forward in terms of understanding the role of the multi-sectorial approach to improving health. And you talked about the faith-based institution. I wonder if both of you, Ann and Jennifer, can talk a bit about how you bring other sectors into play to this whole notion of culture and health.
I'm happy to dive in on that one first. I think one of the things we've been doing are the two projects that we've been working on with the basing, sort of using the nursing home as the home base in a community, mainly through the funding system that we've been going through, which is the Civil Monetary Penalty Fund through CMS.
Mm-hmm.
When nursing homes get violations, you can write grants against that fund to improve quality of life and quality of care. And so we've been encouraging the nursing home staff to do what we call creative community of care building. And we have tools for asset mapping for them, for understanding the creative assets that they have in their community, because too long-term care, which was based on the hospital model, really doesn't see itself as part of a community. It's built, because it's built on a hospital model, it's built on a transitory model rather than a place where people are actually living and embedding in a larger community. So the work that we're doing there is trying to teach them those tools to identify community partners that could help them. Who's in your neighborhood, who's down the block, where are the schools, where are these different kinds of partnerships that we're teaching them actually to identify and build relationships with. And many of those organizations are already faith-based, but aren't necessarily connected more deeply into their faith-based communities. So those are low-hanging fruit for them to start relationships with. As trying to train both that the nursing home as a center to see itself as being strength-based rather than trying to get people to come in and take pity on them, to partner with them in that passive negative way, but to change that lens toward a position of strength and looking at all the assets that they have in their organization and the people who are all living there and working there and how they could become part of their larger community. So the types of partnerships that we've helped people build are with cultural institutions, again, that don't often see that they could be connected in a meaningful way with elders, particularly, again, the group I work with pretty profound disabilities. And then also trying to find ways to reduce the shame of transition in late life for people who are currently living at home, but who, never, ever, ever am I ever going to go into a nursing home. And the shame and the fear of congregate settings, you can use those partnerships to reduce that and to create a connectivity across those transitions that end up really reducing the trauma of having to go, even if it's just temporarily, into either a hospital or a long-term care setting, that you're helping people set up relationships across those systems using culture as the connective tissue.
I love that statement. Using culture as the connective tissue, because it is about building community in different ways. I want to jump to some of the questions that are starting to come in from our listeners here on this webinar, so they can participate. A very interesting question here from Jennifer Armstrong about the kind of career track that someone could go into, and this is for both of you. If you want to go into this kind of community health work that integrates cultural, physical, social, spiritual health, what kind of degree programs should we pursue, and what kind of jobs could be attained? We're really plowing new territory here and redefining how we approach the health of individuals, families, and communities. So, what would you advise Jennifer in her thinking in terms of career track?
That's a very good question, because if you ask me, I don't know how I got here. But I have a very eclectic training, from health psychology to a biostatistics degree, to a research degree, to then my public health. But I think the opportunity here is that we're having conversation with our schools of public health. We're having conversations with our colleges of public service. And quite frankly, we're working in our region to really integrate these, culture and art-based health presentations. And so we're having those dialogues at our health department. We're having those dialogues at our Department of Transportation. And so I think what we're trying to do, at least in the state of Arkansas, is saying no matter what your degree is in, whether it's transportation or planning or health, that you're exposed to this.
How about you, Ann? What would you advise?
I think it is a little bit of you can feel the field forming itself right now. And so truly you can kind of see all the hyphens, merging in from both perspectives, from the health perspective, particularly public and community health perspectives, and then also from the arts, that is starting to move toward civic practice. And that the health sector is one of the practices, one of the areas within that civic practice focus for artists. I think it depends on if you want to lean a little toward the arts or if you want to lean a little more toward the health side. You can always do the double whammy of the MFA in community engaged practice and the Master's in Public Health. I would love some program out there in the world to merge those two things. Would be awesome, but I don't know that exists right now. There's starting to there's a program of arts and health management out of University of Oregon, but it's more where the field has taken hold first is in hospitals, which have large arts programs, and they need people to manage those. So it's even a little bit, the field is forming. I think the key is to do things like this, where you form partnerships with people who have those training, and then you start talking across your own training from one to the other, and find places where those cross-sector conversations are taking place. It literally is forming under our feet as we're having this conversation.
No, I would absolutely agree. I think that, you know, my training is in public health, and at the time that I attended UC Berkeley School of Public Health in planning and policy in health education, it was very traditional, and so you know, it was very much attracted to hospitals and more of healthcare management. And so I really had to find my own path, and having an arts background and a community organizing background, I used my time to take elective courses and in a broader perspective to understand the whole focus of how we address issues of community, and that was very helpful. And I think that the health education field is changing dramatically in that context. And if there's any place that you'll really see the emphasis on the social and environmental determinants, it would be now in health education. So if your track is more toward health, as was indicated, I would certainly indicate that would be a track to take. And but really, if you have in your mind what you want to do, you can find it in many different places, and use that to move forward.
I would also just add that the other place within the arts that's starting to become interesting is this. I have a baby version here at University of Wisconsin-Milwaukee, which is arts and social entrepreneurship, and that those sectors are, again, health is one of the sectors within that entrepreneurship model, and really, the name social entrepreneurship just means that it doesn't exist yet, and you're learning how to build it yourself. How to make a sustainable program, what partnerships you need to build, and looking to the skill sets you need to develop to do it.
Sure, and I think the work that Matt Fluharty is doing with just building this whole field of the culture and art and bringing it all together is I think a real entrepreneur in that area. It's an interesting question here from Deborah Lucero from Redding, California, and it's a little bit long, but I'll take a little bit of time to read it because I think it's important. They're using funds from the California Arts Council in Redding, California, to establish a homeless art project. So using the idea of large format paintings and journals and sketchbooks for creative expression, for then a public community display and sales. They think it's a groundbreaking national model. And they're doing improv with all this and struggling with mental health issues. So this very, what they think has been a very successful model, and it sounds like it. Their question is, do you know of any other programs like this, or better yet, funding for these types of projects for nonprofits, for these kinds of organizations? I think it's a great opportunity to address such a difficult population through the use of art. And wonder if Jennifer or Savannah, if you have any comments on advising her on that.
I was just bending over to my bookcase to see if I could find the book that has the profile article on a large homeless project that was all arts-based in Vancouver several years ago. It's out of a Canadian Journal on Arts and Health work that brought all these, the sort of the best of into a book. So, but of course I can't find it immediately at the top of my fingers. So maybe we can send that back out to folks who are on the webinar.
And I was going to jump in. Funding is always an issue, and I see in the Q&A a couple of questions about funding. And I think this is twofold here. I think the first one is sort of making sure that if you're the grant writer, that you're inclusive of partners and collaboratives that include the arts and culture community. I think secondly, as a practitioner, it's having the conversations with the funders, which is what we're doing right now, of saying, you know, and I know we've mentioned this before, but the metrics, and one of the questions in the Q&A was, you know, how do you convince funders about this quality or impact? And I think this is where, Mario, you led to it earlier, is where the academicians can really come together with the artist community and look at, you know, both the measurable in terms of what we would say in health, decreased blood pressure, weight loss, those kinds of things, but then also the value of the number of stories that you can tell. And so I talked about the photo voice. So, you know, we can say we have, you know, X number of, you know, photos that indicate this. And so there is, I think, a way to quantify for funders sort of how this collaborative works. And then you throw on top of that economic development measures or community development measures. So how many miles of trails was laid? And you get this more collective impact data that I think then when you go to funders, like I was mentioning, and you have those conversations, you can say, hey, this really needs part of the RFA process, you know, the FAQs. This is really how the funding stream should go so that we can maximize the resources and really the richness of the programs that we can offer. And so I think the earlier question about how do you get trained, you know, I wasn't trained in the arts, but I can understand the value of them. And as a health practitioner, it's my, you know, responsibility and really my passion to make sure that that is included in our programming strategies and our mechanisms and really our strategic planning. So, you know, how do you get funders to do it? You start collectively impacting the community and then share all of that data amongst the partnership and then create a beautiful evaluation document and then hopefully have the conversation. And that's actually where we're going in Arkansas. We're having some very candid conversations and some site visits from federal agencies even to say this is how it can work. And so having those success stories, having those stories, as Ann said, which is one of the things that we've worked a lot on. Our community wants to tell its story. And through telling its story, then it becomes, you know, perhaps not a research-based model, but an evidence-based model where the academicians can add rigor through our frameworks and our evaluation techniques.
Yeah, no, that's great. No, that reminds me of the work that we did at the California Endowment to develop a whole new field of when there are, for example, community development projects that are taking place that could have a detrimental impact on the life of the community, developing the whole science of health impact reports as opposed to environmental impact reports. So that the community could have an input into just whether or not these are appropriate to do in these communities. I would also, you know, there's an interesting question here for Dr. Jen having to do with the fact that you talked about going back to homesteading and canning. And they want to know, do you attempt to introduce those into your community building skills and how?
Yes, absolutely. Again, for lots of rural communities, we live in a food desert. You know, I'm in a town of 2,500 with one grocery store with prices that are outrageous. And, you know, so we're really talking about, you know, how do we increase access to healthy foods? And one way to do that, again, is through, you know, community gardens, co-op gardening, sustainable farms. And so even at our local school, we have worked with the art department, the science department, and the ag department, and really built, or working to build a sustainable farm at our school. So, you know, how are we even teaching sustainable farming to our youth? And so we've actually built a youth coalition. And so we can start training this sort of next generation of professionals, you know, about how to do this integrated community development work. And so, yeah, we're introducing those skills. Again, cooperative extension, you know, has been doing homemaking and canning and those kinds of things. But then how are we integrating that into today's society? So, you know, you were asking the how, it's understanding now that we have, parents that may work 2 to 3 jobs. You talked about the poverty, Mario, earlier in our area. So, perhaps it's freezer meals, or, it's what you're canning, not necessarily, the how to can, which may be important, but also the what you're canning and how does that fit in with, again, your lifestyle that is different now, than it was perhaps 20, 50, years ago, through the canning process. So that's kind of the why and the how. We also know, again, in our town that we have a lot of people moving back, whether it's caring for the elderly, as Ann mentioned, that's an important part of our heritage is caring for our elderly. So you have a lot of millennials moving back. You have, a lot of middle-aged or older adults that are moving back to take care of family members. And they're inheriting these, 10, 12 acre farms, as well as potentially the larger row crops farms that they may be doing. So how can they then use that 10 or 7 to 10 acres around their house to increase the food access in our community? And so, we're probably not going to move away from rice production and corn production and cotton production, which is our main source of income for our community. But again, how can we take that 7 acres that's just, sitting between your house and the big farm, as they would call it, and put cantaloupes and watermelons and squash and okra on that? And so co-op farming, again, has become big. CSAs, and how we use those in a food desert has really become a strategy that we're talking about.
Yeah, that reminds me of a project that we're involved with here in Sacramento, where I live. The Center for Land-Based Learning, which I'm on their board of directors, is located. We're completely surrounded by agricultural farms here, even though we're a relatively medium-sized city. But 15 minutes in either directions, and you're in rice fields or in orchards and tomato farms and such. And so we have this program where we bring kids, high school students who've never left the city, who've always lived in the urban areas, and bring them out to the farm to learn where their food comes from, and to learn what's involved with agriculture and farming, and getting a greater appreciation of protecting of the natural environment. And it just has such a tremendous impact on those students to be able to see, the nature of where their food comes from. It doesn't come from a can, it actually grows, and how to actually be involved in getting your hands dirty in the dirt is so important to building that sense of culture of where they're from.
And I think on the flip side of the farming piece of that is that we know that farmers are also work from sun up to sundown, and they're less likely to go to the doctor's office. So, having this sort of small homesteading farm allows you then to enter into bigger conversations with your large row crop farmers. So I'm kind of known as the blood pressure lady. So I take my blood pressure monitors out to the farm. And so again, that's that, idea of meeting people where they are, instead of expecting them to come and seek health care, is making them healthier within their environment. And so, we've started a program where we work with our cooperative extension ag agents, and we can team up with our local nurses and public health unit, and take our work to the farm instead of having the farm workers come to us.
Yeah, that's great. Ann, there's a question here that goes back to, but it seems to be a theme in some of the questions coming through, and that is it's an evolving field. Nonprofits and community organizations want to do more of this whole connection between culture and health, and are trying to locate places in which they can get funding. And you mentioned a fund that comes from nursing home violations. Can you talk a little bit more about that? And is that something that's available nationally, or is it just in your area? Because that really is intriguing.
Every state has it. It's civil monetary penalty funds. You can just search that in your own state and find that. And we're using that same model to extend in Wisconsin, and then also to start a project in Kentucky, with all rural nursing homes and kind of reorienting them to become cultural centers for their small communities. Because they have a lot of assets and they get overlooked as an asset for their community because of stigma. I also would love to say that one of the things that you'll run into, I think, particularly the artists, is that the finding a way, and it's magical in any kind of circle you're going to use. So if you have an ensemble, figuring out how to distribute the power and the vocabulary and the goals across that and to articulate those in that circle. So if that's the community members, if that's the cross-sector partnerships, what can happen and what has happened, I think, when you look at the arts and this 2 centuries that we have of splitting arts and health, we're now seeing them sort of come back together in various moments and forms. And in some of those, the health is dominant. So that's the therapeutic look at the arts. And in some, the arts will stand on their own. And I think that's the strongest, is when you're in a partnership where the arts and culture speaks from its own footing and its own inherent value, as equal partners with the health sector itself. And one of the ways you do that is by making sure your funding stream is also balanced, so that you get high quality arts funding for a project, which I was happy to see that the homelessness project actually starts with arts funding. That's great. But making sure that your funding portfolio is balanced also balances the power of how your project will be seen by the public. So that if you're getting social sector or health sector funding to support the work, it will be primarily seen with those lenses, and those will be the primary goals that you'll be accomplishing in your outcomes measures. If you're primarily getting the arts funding, those will naturally dominate as the measures of your success. And so to make sure you're merging and doing a true merger of arts and culture and health work is to make sure your funding portfolio and your outcome measures are balanced between them.
Those
And I was going to say, I echo that, and that's exactly what we've done. We have a unified funding strategy where health is bringing their dollars to the table and arts is bringing their dollars, and then together we figure out how those are maximized and spent. And so it's like, oh, you through the arts can get $30,000 for the park. Okay, well, over in here in the health world, we can get the X number, and then we build a project based on that. Collaborative funding model. So it's very important. I would say that's why I'm jumping in, because I think you're absolutely right.
It's tricky and hard to manage, but it's the best way to do it.
Right. Well, no, I think those are, I think, 2 great closing statements from both of you. I think I'm just excited to hear about both of your approaches to the work, and having the vision to be able to see beyond the categorical nature of how funding comes from government or even from foundations, that you basically have to play to their tune, and really breaking the mold to think about the whole person, the whole community, the whole family, and all the different contributors to both physical and mental and spiritual health that the arts and culture can bring to bear. This is what we're hoping to see more of, the notion of multi-sectorial approach to bring all the assets, to take it more from the asset-based perspective that we see happening, and recognize that despite the fact that a community may be quote unquote in poverty, that it's very rich in culture, and that does contribute to a sense of well-being and pride. So I want to thank both of you. You've just been inspiring, and I'll turn it back over to Matt.
Hey there, folks. On behalf of Art of the Rural and Rupri, we'd really like to thank Anne, Jen, and Mario for their time and their amazing insights this morning. We'd also really like to thank everyone across the country who tuned in, checked this out, and offered questions here. And what I would maybe leave with, I mean, there were so many amazing, like almost spiritual bumper sticker statements that came out of this conversation. One being storytelling and culture are the connective tissue. And you know, this other one, which I really love. I love the idea of like going around town in a bike or an automobile with a sticker that says, "The field is still forming." Yeah, I love that as a statement of a promise. And why I say that, you know, is that we're so grateful for two organizations that really have helped foster that kind of spirit: the National Endowment for the Arts and the McKnight Foundation, which have really helped make this entire series possible, and have been great supporters of the Next Generation Initiative now for many years. So this conversation that we had today was produced at the Outpost Collaborative Space in Winona, Minnesota. Collaboration, the headquarters of Art of the Rural. This conversation itself was a collaboration between Art of the Rural and the Rural Policy Research Institute. We're so grateful to Anne, Jen, and Mario. And I'm excited just to close this out to share with you not only one, but two amazing Next Generation Digital Exchanges coming up for folks to check out in the month of July. The first, on July 12th, will be a webinar about an extraordinarily exciting program developing in the Delta Regional Authorities region, a creative placemaking initiative. We'll be joined in that conversation by Chris Massengill of the Delta Regional Authority, Joe McKinney of the National Association of Development Organizations, Linda Langston from the National Association of Counties, and Jennifer Hughes from the National Endowment for the Arts. And then, just 7 days later, on July 19th, we have another Next Generation Digital Exchange webinar looking at knowledge building within the rural creative placemaking field. We have a really wonderful panel for that as well. It'll be featuring Kylie Arroyo from the Cultural Strategies Council, Judy Jennings from Kentucky, who's a writer and arts organizer, Erica Nelson, who is the director of the world's largest collection of the world's smallest version of the world's largest things. Say that 10 times in a row. She also wrote a recent white paper for Americans for the Arts on this topic, as well as Carl Attia Swanson from Stringboard for the Arts and the Creative Exchange platform. So two really great ones coming up. Please feel free to check out ruralgeneration.org for more information and to sign up for those. But again, thank you so much to Anne, Jen, and Mario for your time today, and thanks for everyone across the country. Have a great rest of the week and take care. Bye-bye.